Hello, my name is Maeve Kennelly. I am a prevention specialist with Wayside Youth and Family Support Network. I am pleased to be hosting this News Now health update. I am here with my colleague, Lisa Gibalerio. Lisa is a public health educator at Wayside, and together we oversee the Belmont Wellness Coalition. Today, Lisa will be sharing some guidance on what to do if your child reports having been sexually assaulted. So let's start with some basic data, Lisa. How common is sexual assault among teens and preteens?
Thank you, Maeve. It is actually too common. According to the CDC, 1 in 5 youth report having been sexually assaulted. Closer to home, we know from the 2023 Youth Risk Behavior Survey that 10% of high schoolers, and that's over 100 kids, and about 5% of middle schoolers in grades 7 and 8, which is about 35 kids, have experienced unwanted sexual contact.
Wow, those numbers are definitely concerning. So next steps, what's the first thing parents should do upon learning that their child has been sexually assaulted?
It's recommended that parents contact the Boston Area Rape Crisis Center, BARC. We also may encourage families to consider reporting sexual assaults to our local police department, but we recognize that not everyone is comfortable or ready to take that step. But BARC will advise families on all of the recommended next steps to take, including how to and when to report to the local police station.
So BARC can help provide a roadmap for those next steps and what happens. But I'm also wondering, is there any advice on what to say to your child?
Yes, absolutely begin by thanking them and acknowledging them for being brave enough to bring this information to you. You know, you could say to them, I know it took a lot of courage to tell me this. Tell them you believe them. Tell them that it's not their fault, that they didn't deserve this in any way. Let them know that you care about them and that you will help and support them in what happens next. And then Maeve, just express that you're sorry that this happened. Let them know that if they do decide to report to the police department, that there may be an investigative process, but you'll be with them and you'll support them through it.
Thank you for those useful phrases. And also, is there anything that is recommended not to say to your child?
Yes, it's recommended that parents not ask too many probing questions. Let the professionals at BARC handle that part. Don't doubt your child and don't promise them that you won't tell anyone, because in reaching out to BARC for advice, you will in fact be telling them.
And what might parents do, if anything, to reduce the risk of this happening to their child or teen?
That's a great question. So there's no way to eliminate the possibility of an assault, but there are some strategies that may reduce your child's risk. But understand that someone could practice each and every one of these strategies, and unfortunately, an assault could still happen. And it's really important to underscore the point that if someone does engage in risky behavior, they never deserve to be assaulted. The person at fault is the perpetrator, not the survivor. So having said all that, yes, there are conversations you can have with your teen. You can talk about the giving and receiving of consent, and there's lots of information out there on how to have that conversation. You can talk about basic strategies for looking out for friends and looking out for each other. You know, even one that goes back to when I was a kid, we were told there's safety in numbers, and that's still true. You could teach them how to be aware of their environment. Also that there are risk factors, and talk about the impact of substance use on judgment and on consent. But again, know that someone can do all of these things and assault can still happen.
That is very useful information. Thank you. Is there anything else that you would like to add at this point, or anything else parents should know?
Just one last point, Maeve, which is that it's important to discuss with our children that sexual assault often happens with a known person. When I was a kid, we were always taught stranger danger, but in fact, data shows that it's not strangers who pose the biggest risk. It's people who we know, whether it's a neighbor, a coach, an uncle, perhaps a clergy person. So just have that conversation with your teenagers, your kids as well.
Thank you, Lisa. This is not an easy conversation to have, but a very important topic. Until next time, this has been a News Now Health Update.